and I'm delighted that I can introduce Tanya Hall, who's one of the people who made a very long journey to come to us, and thank you very much for coming all of this way. So Tanya is the CEO of her organisation in Australia, which is Hearts for Hearts, and she's also someone who's been living with heart disease. Tanya, please come forward and share your experience.
Thank you. Can you hear me? Good. Thank you so much. And thank you, Neil, and to Global Heart Hub for this incredible honour and opportunity to speak with you all today. So my name is Tanya Hall. I'm the CEO and founder of Hearts for Heart. We're a national charity in Australia that provides support, education, and we advocate for Australians and New Zealanders living with heart disease. So Hearts for Heart brings together patients and healthcare professionals with a shared goal to reduce the burden for heart patients. And we achieve this through support, information, education, awareness campaigns and advocacy. But today I come to you as both CEO and as a heart patient. And before I talk to you about the importance of early diagnosis and some of the work that we've been doing in Australia, to advocate for heart health checks, I wanted to provide you with a little bit of background on my own personal story and what led me here. So I was born with congenital heart disease and have lived with heart disease all of my life. However, when I was going through a particularly difficult time and I looked for information and support and I wanted to be involved in the shared decision-making of my own health, I realised that there wasn't anything available. And so and I also recognised a limited awareness of the various heart conditions that exist, including my own. And I'd worked with a number of charities in the past and I knew what was available for support, so I just couldn't believe, in particular because of the prevalence of conditions like arrhythmias, heart failure and heart valve disease, that there wasn't anything that existed. So I thought, why not start something myself? And originally I built a website so that I could share information that I had learnt along the way, provide peer support to patients and connect people who are going through a similar experience. Sorry, there we go. Better? Okay. And once I built the website, we grew really quickly. And that was in 2011, and now we as an organisation, we run national awareness campaigns for heart valve disease, AF Awareness Week and heart failure. We also provide peer support and education for patients, and we are the only patient-led organisation involved in health policy. Government reaches out to us whenever there's a new application for a cardiac medicine or device. And we also provide an integral role in terms of advocacy and if there are any sort of barriers to treatment. We're also a consumer representative on numerous research, clinical guideline and health policy reviews, bringing the lived experience to these discussions. So in 2011, and 3 months after I launched Hearts for Heart and stood on stage encouraging everyone to get a heart check, my own father died suddenly from undiagnosed heart failure, and he was only 59 years old. He'd gone to his GP 3 days earlier because he was very unwell and he was misdiagnosed as just having a severe case of the flu. He obviously didn't have his heart checked. So I can't explain the devastation, that had on myself and my family. And this still drives my passion every day. To raise awareness, to encourage heart health checks, early diagnosis, and to ensure that patients have timely access to therapies. While each of our campaigns, AF Awareness Week, Heart Failure Awareness Week, and Heart Valve Disease Awareness Week, provides information about the condition, highlighting symptoms, statistics of those living with heart disease, and those who remain undiagnosed, our key message is always very simple: go and get your heart checked. In addition to that, we're always telling people not only to get your heart checked, but what to ask, which is obviously to include a stethoscope check as part of the heart check. In Australia, people are currently eligible to have free heart health checks within their primary care with GPs. The heart health checks are offered to those over the age of 45 and for younger Indigenous Australians. The heart health check historically involved a risk assessment of developing heart disease, a blood pressure check, and a cholesterol check. However, it didn't include a stethoscope check, which obviously meant that patients living with heart valve disease, arrhythmias, and heart failure were often undiagnosed. So earlier this year, the heart check was under review, and we took the opportunity to meet with the Department of Health to advocate for a stethoscope check to be included in the heart check. And during that meeting, it became very clear that the government were planning on scrapping the heart check entirely. And so, obviously, this was an incredible shock to us and made us incredibly nervous because it was 4 weeks prior to the next budget announcement. GPs had only been doing heart checks for less than 6% of patients prior to the implementation of these heart checks, and so we needed to act quickly. As soon as the meeting ended, I got on the phone to every CEO or leader in the cardiac space, including the Cardiac Society of Australia and New Zealand, which is a governing body of cardiology, the Heart Foundation, research organisations, and most of the key players in cardiology. And they all agreed to support me in writing a joint consensus letter on why we must continue funding the heart health check and to include a stethoscope check. So I sent this letter to every MP, senator and politician asking them to write to the health minister expressing the importance of continuing the heart health check. We organised a national poll with the general public asking them to sign the petition to save the heart health check, and we also embarked on a national media campaign. Through this collective work, and a week before budget, the health minister announced to us and to the national press that he had heard us and that they would be continuing the heart health checks and that they would be including stethoscope checks. Needless to say, we were beside ourselves. We'd been involved in a number of advocacy projects, but never ever had we had to get anything over the line as quickly as we did. And I think this is a perfect example of why you should never underestimate the power of the patient's voice and the unique role that we play in having the ability to bring stakeholders together to unite on causes such as the heart health check. And we still have a number of barriers that we need to face, which obviously includes raising awareness within the GPs to, in the importance of heart health checks. And we have, Australia is a very large country and we've got 300 communities without a GP. So, we are looking at ways in which we can implement screening. But it's something that we are doing, collectively together with other organisations and obviously with GPs. So in closing, I refer to one of my quotes, and I did hear Neil say it yesterday, which is nothing about us without us. In an ever-changing world where healthcare has become more patient-driven, it has never been more critical. Identifying patient standpoints on their health condition and treatments offer an opportunity for critical discussion and promotes communication, exchange and agreement about the appropriate course of action. All those years ago when I had thought of starting Hearts for Heart, I knew that there were a number of problems that needed to be addressed, but I wasn't sure how to go about it. Everything I learnt along my own journey. Patient organisations and patients have influence in government that media and in media that often industry or even sometimes clinicians don't often have. So I just really want to send the message that never underestimate the difference that patients can make and the power of the patient voice. Thank you.